Patients are always curious about what to do after surgery, what's going to happen after the surgery is complete. On the day of surgery, the patient will go to their hospital room, which is on the orthopedic unit. There you'll have specialized nurses that have been trained in orthopedic care, in particular with your hip replacement. They'll know, they will have seen many patients just like yourself that have gone through it, and they'll know just what to do to help you feel comfortable and to help work on controlling your pain and those kinds of issues. It's anticipated that all of our patients will get up the same day of surgery and at least take a few steps and sit in a chair. For the patients that are done early in the morning on surgery day, likely they will get up a few times on the day of surgery before they go to bed that night. Great emphasis is given for pain control and for getting you up and getting you mobilized sooner than later. After your hospital stay, patients will go home on the day after surgery, sometimes the second day after surgery, after total hip replacement. More and more of our patients are going home sooner and sooner as we're able to do a better job controlling their pain and getting them up sooner. What happens after they go home is a common question. Well, we want the patients to work hard, but not be overly taxed with making trips to and from therapy early on. So most of our patients have home health PT that comes out to the house and helps take care of them, do their exercises, and help them continue to make progress on their activity and on their strength, as well as help keep an eye on your wound or answer questions that you might have after surgery at home. Patients will frequently ask, when can I return to work? Most of my hip replacements are through the majority of their pain and struggles by about postoperative week 6. Some will go on to postoperative week 8 or so, but many of our patients are really quite well and doing well sooner than 6 weeks if everything goes well. So patients will say, when can I go back to work? Well, it depends what kind of work you do, of course. Sedentary jobs where you're sitting much of the day or not terribly active, you might be able to go back as soon as 2 to 4 weeks. If you have a pretty demanding job where you're on your feet all day, long hours, it might be closer to 6 to 8 weeks before you'll feel up to going back to work. And some patients a little longer than that even. And we play that by ear, of course, and individualize our strategy based on the type of work that you do and the types of activities that entails. Finally, patients frequently ask, when can they drive again? Certainly, especially for patients who are having a right-sided hip replacement, safety is a significant consideration after you've had your hip replaced. We want you to be safe while you're driving. Most patients drive an automatic transmission. Some patients drive a standard or stick shift transmission, and that changes the requirements of one leg versus 2 legs. But in short, I don't give patients a specific timeline. The state of Oregon issues your driver's license, not me. I think that it's incumbent upon all of us to understand when we are safe or when we can safely operate a car. Certainly, I emphasize the point that it's illegal and not recommended to drive while you are on narcotic pain medication, as that's illegal. I think my patients are intelligent and trustworthy, at least I hope they are, and that they'll go back to driving when it is appropriate for them.